If you think that the problem is solved, you are mistaken. Or maybe we just don't care, so we don't know either. It cannot be unknown to find out that this is the truth. We are in danger. To almost worldwide, there is a decrease in transferring of HIV, but here in the Philippines, the population of the people who are at risk are increasing. HIV knows no age or gender. Men, women, homosexual or heterosexual, and even kids are now infected. It becomes a mainstream disease. We are really in danger. This kind of disease has no cure. It is a lifetime struggle. What should we do about HIV or AIDS? In other countries, it is normal to have a blood test. Yes, people, get tested. It's cool to get tested. You don't need to die just because of HIV or AIDS. All we have to do is to avoid or prevent this from spreading. We are really in danger. It's cool and better to get tested.
In July 2019, an average of 40 newly diagnosed cases per day, ages between 15 to 24 years old,
compared to just 7 daily reported cases in 2011.
170% the HIV epidemic in the Asia-Pacific region is expanding fastest in the Philippines.
Since 1984, 66,303 confirmed HIV cases in the country. 18,831 or 28% were among youth.
HIV. HIV is a human immunodeficiency virus. It's a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases.
The HIV does not choose age. Even a 12-year-old kid is positive from HIV. The misconception on HIV was a death sentence, which was not, because it has a high chance of survival rate with early diagnosis and early treatment that can cure this immediately. According to the DOH, we need to have a comprehensive sexuality education from elementary to high school, because only 7% of youth have the knowledge of HIV and AIDS.
HIV transmission can be prevented. There are ways to avoid or at least reduce contact with body fluids that transmit HIV. HIV is transmitted or spread through the following body fluids: blood, including menstrual blood, semen, vaginal fluids, and breast milk. There are a lot of misconceptions about the transmission of HIV. HIV cannot be transmitted through sweat, tears, saliva, feces, and urine.
The effect of HIV was the stigma and discrimination, because they do not know how the virus is transmitted. They only know that it is a curse or a sick. It can affect the mental health of a person with HIV. They have a stigma on themselves, and that stigma is killing them, that they want to kill themselves.
Republic Act 11166 and HIV Policy Act on 2018,
Act strengthening the Philippine Comprehensive Policy on Human Immunodeficiency Virus and Acquired Immune Deficiency Syndrome Prevention, Treatment, Case, and Support.
Difference between HIV and AIDS. HIV is a virus that invades the immune system, while AIDS is a last stage of a spectrum of condition initially caused by the infection of HIV. HIV patient will suffer minor difficulties, symptoms will be similar to flu, while AIDS patient will experience severe signs and symptoms disrupting the quality of life.
HIV-negative individual prevention. First, educate yourself and others. Second, know the HIV status of any sexual partner. Third, use a new latex or condom every time you have sex. Fourth, consider male circumcision. Fifth, use a clean needle. Sixth, be cautious about blood products. Seventh, get regular screening tests.
Don't be afraid.
The risk is not knowing. Have an early diagnosis.
Stop the discrimination.
They live among us.
Don't lose your life. Don't lose your life. Don't lose your life. Stay away from HIV. Stay away from HIV.